Did you know that you can have a concussion without ever actually hitting your head? And most concussions don't even cause you to pass out. Hi, I'm Dr. Arryn Gamble, and if you've recently had a hit, fall, or accident, and you're not feeling quite right, then this video is for you. We're going to break down what a concussion really is, the symptoms that you should be on the lookout for, and when it's important to get medical help. This is the first video in my series called Concussion Recovery Essentials, where I simplify the most important things that you need to know about healing your brain. I'm a neurophysical therapist who specializes in concussion recovery, and I work with people all over the world through my virtual coaching program. My goal here is to give you the information that I wish every patient had on day one. So, what actually is a concussion? A concussion is a mild traumatic brain injury. And I don't love the word mild here because for someone dealing with a concussion, these symptoms may not feel mild at all. A concussion happens when your head or even your body experiences a force that causes your brain to move rapidly inside of your skull. That sudden movement can cause stretch and disrupt brain cells, which then changes the way your brain functions temporarily. Now here's the key. Concussions are about function, not structure. And that's why CT scans or MRIs often come back looking totally normal even if you feel terrible. And that's also why recovery isn't always straightforward. It's not a broken bone that you can see on an x-ray. And this also makes the severity of your concussion symptoms very difficult for other people around you to understand. Concussions can show up in a lot of different ways. The most common symptoms fall into 4 categories. Physical symptoms, things like headache, dizziness, nausea, eye tracking issues, light or sound sensitivity and balance problems. Cognitive symptoms, so difficulty concentrating, brain fog, slower processing or memory issues. Emotional changes like irritability, sadness, anxiety, or mood swings. And sleep disturbances, sleeping too much, not enough, or just feeling exhausted all of the time. And here's the tricky part. Not everyone gets every symptom. Some people may have 1 or 2 symptoms, while others feel the whole mix. As a rule of thumb, after an initial head injury and you're experiencing any symptoms, it's always good to go get checked out. And most concussions will improve over time, but there are certain red flag symptoms that you should never ignore after the injury or during recovery. If you or someone you know experiences worsening headache, repeated vomiting, slurred speech, confusion, seizures, difficulty waking up, or one pupil larger than the other, go to the ER right away. These can be signs of a more serious brain injury. So to recap, concussions are functional brain injuries, not always visible on scans, with symptoms that can affect your body, your thinking, your emotions, and your sleep. Knowing what's normal and what's not is the first step towards recovery. If you would like more guidance, keep following this series where I'll cover myths, recovery timelines, safe return to activity, and more. And if you're already struggling and would like one-on-one help, I do offer virtual coaching through my program designed specifically for people with post-concussion symptoms. You'll find the link in the description below. Thank you so much for watching, and I'll see you in the next video.